A very warm good morning to everyone. I am Anjali Maheshwari, Retina Fellow at LV Prasad Eye Institute, and I'll be presenting on atypical unilateral retinal hemorrhages in a preterm infant, a diagnostic challenge. So, 3-month-old male child. I- yeah.
Slides are not
Slides not
moving.
moving. Kindly see to it. Please help her. Nothing is coming on her screen. Yeah.
Wait. They have to do. You will get full time. Don't worry. It is 5 minutes you will get. That's what. अभी time आ गया.
Yeah, it's
Anjali.
Anjali. Dr. Anjali. Yeah, they'll correct.
They will do.
Yeah, they'll do. Yeah.
Timer again back to 5. Timer can you change? Reset. 5. Correct.
Yeah. Now you can start.
Hopefully.
Yeah, start.
Okay. So I am Anjali Maheshwari, Retina Fellow from LV Prasad Eye Institute, and I will be presenting on atypical unilateral retinal hemorrhages in a preterm infant, a diagnostic challenge. So a 3-month-old male child with a birth weight of 1010 grams and a present weight of 2600 grams with a birth history of preterm delivery at gestational age of 30 weeks and C-section delivery, came with past history of undergoing anti-VEGF injection in both the eyes under the diagnosis of AROP, and he was referred to us for further treatment for retinopathy of prematurity recurrence. So on initial evaluation, as we can see in the fundus photograph, the right eye appeared like it had recurrence of the disease, but the left eye had no retinopathy of prematurity. But since it was unilateral in presentation, we thought of other causes of this presentation. So we went through the history, clinical examination, as well as the fundus photograph, and came to 3 differentials. First being ROP recurrence, second being hemorrhages secondary to any systemic cause, and third being any non-accidental injuries. The non-accidental injuries were ruled out after a thorough history and evaluation. But we went back to the fundus photo, and on careful looking, we see that there are these white-centered hemorrhages with multi-layered hemorrhages, and we can see that there is no tortuosity or dilatation of the blood vessels in the right eye. The left eye, on indented evaluation, we could see some peripheral persistent avascular retina. We advised a complete blood workup to rule out any other systemic cause. The hemoglobin was 7.6 gram percent. The RBC count was 2.48 million per millimeter cube. And the platelet count was 2.40 lakhs per millimeter cube. So with this, with hemoglobin less than 10 gram percent, we made a diagnosis of anemic retinopathy in right eye, and the patient was referred to pediatrician for further cardiac or thrombotic, to rule out any cardiac or thrombotic causes. The patient was started on oral ferrous ascorbate drops, and frequent follow-ups and monitoring was advised by the neonatologist. At 4 months after the first follow-up, the patient again presented to us with a hemoglobin of 12.3 gram percent. And we can see this change in the 4-month follow-up photograph where all the hemorrhages have resolved except for the one which is in the superior temporal quadrant. And here at 6-month follow-up, we can see that there is no hemorrhages, and even the left eye had complete vascularization at this time. So the common signs of anemic retinopathy includes retinal hemorrhages, soft exudates, venous tortuosity, vitreous hemorrhage, or disc edema. So according to Sudhalkar et al., the most common causes of spontaneous vitreous hemorrhage in Indian subset includes vasculitis followed by hematological disorders. So anemia of prematurity can affect the outcome and course of ROP, and it can also mimic ROP in certain cases like ours. The implicating factors include internal factors like slow production of red blood cells or shorter lifespan, the external factors like blood loss, poor nutrition, and sepsis, and all these can aggravate low weight gain, poor oral intake, and apneic episodes, which in turn can aggravate anemia of prematurity. So, in conclusion, there is no substitute for a detailed history and in-depth clinical examination. And significance of timely and correct diagnosis helps in rationalizing treatment with multidisciplinary approach. Thank you.
Thank you, Dr. Anjali, for
Thank you.
taking time.
Yeah.
Any questions? Why is it unilateral?
So there are cases which have been reported in adults that it can present as unilateral retinopathy, even any systemic causes like anemia as well.
So, yeah, please. You go.
It was in the preterm.
It was in the preterm.
So have you taken any history or obstetric history?
So there was no maternal anemia or the history of any sepsis. The child was born by C-section, but we did do a thorough evaluation. The patient also underwent 2D echo and USG because we also wanted to rule out sepsis and other causes of these Roth spot that we could see. But everything turned out to be normal except for the blood workup, which had showed anemia.
Simply by the hemoglobin, you cannot say it is anemia. You will have to do the ferritin, then oxygen concentration, everything.
Yes.
So how you can label it as a...
So the patient was referred to neonatologist, and they did
He told.
Yes. So they did a thorough evaluation and workup, and after that the patient was started on oral ferrous ascorbate.
my dear, you told that she was on the anti-VGF.
So yes, she was injected before for AROP elsewhere before he came to us.
So before giving, what is the schedule of this? Can we start the anti-VGF in the beginning also only?
Yeah, so if the patient presents with bilateral aggressive retinopathy of prematurity, that's the first line of treatment that we give.
But this was having only unilateral.
No, that was before, like he presented to us 2 months after the injection. So, so after birth, he was diagnosed with AROP, given injection to treat it. But later again, when they saw that it's unilaterally occurring, they referred to us for further treatment like laser or any further injection.
So, anemia of prematurity is not uncommon disease.
Yes.
So, how many patients of your ROP are having anemia of prematurity? You have any records, and how many of them present like this?
So there was a study by Lee et al. So which showed that 28% do present with anemia of prematurity and then retinopathy, but it can get aggravated with thrombocytopenia if it is additionally present.
So, why in this case and why one eye? What is your thoughts?
Yeah, so that was also something we were also wondering, because anemia is systemic, as a systemic disease, should present bilaterally, but we went through the literature and there was not much literature in infants, but we saw the literature on adults. There are few cases which are reported to have unilateral causes, but again, the cause or the pathophysiology for the unilateral presentation is not something that we are aware of.
Anti-VEGF injection was given bilaterally.
Yes, both
so
eyes.
it means one eye may have responded well to the anti-VEGF,
Yes.
and
Maybe
anemia added to the
Yes.
that may be the cause. Good case.